There is a consultant psychiatrist here in this hospital. We've been working together for many years, and she's going to talk today to us on depression and chronic illness. And maybe you want to start an introduction for everybody?
Yeah, maybe who are clients of Dr. Danish? Patients. And the rest are
Some of caregivers and some also with very mixed, I think, medical students, patients, a whole mixed bag.
Alright, so Dr. Danish approached me and suggested that I speak about depression. So he's very, very right by saying that depression is so common among patients, even among people, normal people like us, get depressed. But that kind of depression and what patients who suffer from liver cirrhosis have depression is a different ballgame by itself. So, in our understanding of depression, can anyone just come up and say what do you think depression is all about to you? What's your understanding of depression? It doesn't mean to be a correct or wrong answer, but can be anything.
Sad, very negative.
Yes. Anything else?
Crying,
Moody. Sorry? Losing temper.
jealousy,
Yes.
anxious.
But sorry?
Self-withdrawal.
Self-withdrawal, yes. But do you realize when you have, for example, the clients who are diagnosed with liver cirrhosis, do you all talk about, whenever you see doctors, do you talk about just liver cirrhosis, or you also talk about all your feelings? Do you address your feelings? You usually don't, It's because our focus is our health, our physical health. The psychological health is kind of behind us, Maybe we feel that, by talking about it, it will make us weak, a sign of weakness, a sign of being lazy, So we put that aside. Plus, we come from the Asian culture, so we don't want to talk about that. So, but we are actually not doing justice to ourselves. Because when we suffer from a chronic illness, and chronic illness is an illness that we have that lasts for more than 1 year, 2 years. For example, somebody who's got a heart attack, somebody who's got diabetes, somebody who's got arthritis, somebody who's got multiple sclerosis. Those are chronic conditions. But along the way, when the condition does not recover, you have feelings of feeling sad, feeling useless, helpless, hopeless, worthless, feeling guilt, having difficulty sleeping, unable to eat, you withdraw into yourself. Those are symptoms of depression, but we do not address it, right? We do not talk about it until and unless somebody feels that, I think there's also depression on board. Alright? So what I'm trying to say is that when you have a chronic illness, whether you like it or not, your mood is down because you're worried about whether you're going to get well, whether the medications you're taking is going to have any side effects on you or not, whether what's the recovery like. So they are kind of, they're intertwined. So, but because we don't talk about it, the family thinks that was part of, because we have liver cirrhosis, it's bound that we are going to be depressed. They think there is normal sadness, but normal sadness and depression is two different things. Normal sadness is, for example, we have a broken relationship, interpersonal relationships are down, or our parents, or somebody is going through a divorce. That is normal depression, which we kind of get over it. But for people who have depression, the depression is long lasting. It's like over a long duration of time. And how severe are the symptoms of depression, which I just mentioned, So the duration, the severity of the symptoms, coupled with difficulty in sleep, not eating well, and impairing your functioning. For example, if you are working and you can't focus, you can't concentrate, and you cannot give 100% of yourself at work. So your functioning is also affected. So when all this comes together, this is what we call as clinical depression. Or in other terms, people say, your mood is down, or it's just a sign of weakness. But it's not that. It's actually biological depression. All right? It's just like anybody who's suffering from diabetes or hypertension, for which you need treatment. Okay? They are very good quality medications that you can use to treat depression. All right? And also, not only medication, but you can also go for counseling, that is psychotherapy. Or it could be a combination of medication and psychotherapy together that you can use to treat depression. But what I'm trying to say also is that you cannot separate both of these entities. They actually, when it happens, they happen together. All right? It happens together. I would like to take a 1 minute break. I just want to ask you people, are you all with me on the same page, or are you understanding what I'm trying to say? Or am I too fast, or you don't understand anything that I mentioned so far? Yeah, so that's what I'm trying to say, because from the Asian perspective, we do not want to talk about depression. Yeah, we don't usually talk about depression, and sometimes for a chronic illness, you can present with feeling bloated stomach, heart beating very fast, you are anxious, you are feeling hot and cold. So these are physical symptoms that you attribute to maybe a heart attack, maybe something to do with IBS, irritable bowel syndrome, for which you go and see Dr. Ganesh. Yeah, but these are also things that you need to keep in mind, keep in view. Yeah, because sometimes when all these symptoms are there, it's basically just pure anxiety, kanchong. Yeah, it's just kanchong. But the person would have seen so many doctors, and then when somebody one day tells Dr. Ganesh, I think it's anxiety, you need to see a psychiatrist. Yeah, so then you think that was it just pure anxiety that led you to have all these physical symptoms? Yeah, all right. So this is another thing that you need to think about. The other things that I like to mention is that what are some of the tips for coping with chronic illness? Number one thing is that you need to be involved in your treatment. So when you come for treatment, when you're talking to the doctor, make sure you are involved. Ask questions. Don't be quiet and just take what the doctor tells you. Be involved in your treatment. All right, that's number one. Number two is follow a healthy diet. Okay, we tend to actually eat unhealthy stuff, but we need to know that when we are on medication, especially antidepressants, your appetite sometimes increases. That could be the side effect of the medication. So if you talk about it, then when you discuss about it, at least the doctor is then able to adjust your medication or give you medications that does not actually enhance your appetite. Okay, so follow a healthy diet. Learn to accept the illness. When we are given a diagnosis, okay, what goes through our mind? Wow. Right? So actually there are stages of grief or depression. I mean stages of grief. Yeah? There are actually 5 stages of grief. For example, first thing, you are in denial, right? You disagree that I can't be suffering from liver cirrhosis, all right? Then you have anger in you. Why? What do I deserve to get this? Right? Then you are bargaining. You are bargaining with your higher power. Why me? Right? Then after that, it is depression. Then you go into depression mode. And after that is you learn to accept that yes, I have liver cirrhosis and I need to work on that. Alright? So learn to accept your illness. Next one is seek support. Alright? So we usually go and see the general practitioners as the first line doctors. And then they are referred to the specialist, and then So get appropriate help. And the next two things are consider your spiritual power. Whether you like it or no, I think we need to be spiritually inclined. And I have most of my patients who are depressed go and do Reiki or Tai Chi or Qigong or even yoga. Alright? And also find gratitude within yourself. Alright? Depression is something that it's no walk in the park. Alright? It's not a sign of laziness or being weak. Yeah? And you cannot just snap out of it. Okay? Depression is actually a chemical imbalance in the brain. And it's explained by the neurotransmitters, that is, chemicals. And the medications that you take are only to correct the chemical imbalance in the brain. It doesn't have any other function. It doesn't cause dependence. It doesn't cause addiction. It doesn't impair your liver any further. It's just to correct the chemical imbalance. And all these medications are all short-term medications. Yeah, they're not that you need, once you're on medication, you take it for lifelong. It's not like that. So it's not as simple as ABCD, right? But if you can identify and say that or feel that, yes, I am depressed, yeah, I cannot concentrate, I cannot focus, my sleep is down, or I'm eating alone, I'm putting on weight for no apparent reason. Okay? Either you can't sleep or you sleep a lot. Either you have no appetite or you start piling up on yourself. Alright, so these are all symptoms of depression. So if you have depression, you have to speak about it and you have to get appropriate help. Alright? It's not something that you can just come out of it. Not as easy as that. Right? Yeah, I'd like to open up to the floor.
Seeking gratitude. Can you give us some examples?
What I'm trying to say is that it's how you look at yourself. By finding solace and by being more grounded, and by when you find spiritual power in yourself, then you are connected with higher power, and by that you feel blessed that whatever you have, whatever you have, you still feel blessed and move on.
In terms of depression, you mentioned about chemical imbalance in our system.
Sure.
But actually a lot of times it's self-created.
Depression is self-created. It's a myth. Depression is a chemical imbalance, just like somebody who's suffering from diabetes. Yeah? But depression is an imbalance of chemicals such as serotonin, norepinephrine. Yeah? When these chemicals are imbalanced, then the mood is affected. But it is different from normal sadness. Yeah? When you are severely depressed, the chemicals are really imbalanced. So the medications that you are given is to correct the chemical imbalance. And within a week, what you see is that your sleep is improved, your appetite picks up, your facial expression, is much more brighter and you're more alert. And within 2 weeks, if you have the right dose, the depression is almost like halfway, you won the battle.
Could depression be brought on by hormonal imbalances as well?
What kind of hormones are you talking about?
Female hormones, for example.
menopause and things like that.
Yeah, yes and no. I guess it could be, but what I'm talking about here is clinical depression, and when I'm referring to that, I'm referring to serotonin and norepinephrine. That could be a part of menopause, those hormones involved. Yes, it could lead to, but it's not as severe as when you have a clear-cut clinical depression.
When do they, a lot of times you feel down. When you say, okay, I'm depressed enough to go to a doctor to see. When is the line? When do you decide? When should they be sort of a flag sign to say, you're significantly depressed to the point I need to see help?
When you don't enjoy life at all, when you feel that there is no move in your life, you cannot move yourself, you just socially withdraw yourself, you isolate yourself, you keep to yourself. There's nothing that brings you joy, happiness. You just feel empty inside. And sometimes thoughts of harming, self-harm comes into you. You feel that it's better off that you're dead. This is severe, severe depression. You know what I mean to say? It's different than people who have adjustment problems, maybe secondary to failure in their exams, broken relationship, you had an accident, things like that. So this is severe depression that you actually should realize that something is not right. Or you think of overdosing or cutting yourself or harm yourself.
I think the person involved will not walk into the clinic. Somebody has to do that. Usually they say, no, I'm not depressed.
In the majority of the cases, yeah, but there are certain cases in my practice where you actually walk in. But sometimes, in majority of these, they come in with a family member or with a friend or somebody who is rejected.
The treatment be the self-denial.
Definitely. As I
I'm
said,
not depressed, I'm just sad for a while.
Usually, in most patients with chronic illnesses, they don't believe that they are depressed. And even sometimes, the caregivers themselves, she's just, just normal, she's just sad. But when you talk to her or him separately, then you get the, because we do not have any blood test or urine test to go by. We don't have any hard evidence to say that, because of this, you're depressed. It goes with the story that they tell us about themselves.
And is there a possibility that you can still get on with life and maybe not being able to handle stress, yet you have the emotional upheavals?
I didn't get quite get.
Yeah. Okay, for example, like in my case, recently I was talking to my GP, and because of the number of years that she has spoken to me and she has diagnosed my different symptoms, so she mentioned that, although I am able to function daily, on a daily basis, but she said that I need medication to help me with stress management. She said that I'm already on the verge of depression.
I think a lot of doctors put the patient on long-term.
So I want to know exactly, like now I'm getting back into work. I still feel stressed and I cannot sleep at night. And sometimes even just talking, I feel like crying. So how how does that translate to? Is that a case of depression?
You see, first of all, you need to do a full assessment. How long have you been feeling, like this? You have to do a proper evaluation and assessment of, all the symptoms that you're having. If it's severe depression, you can't even move out of bed. Okay? Because there's mild, there's moderate, there's severe, and there's profound depression. Right? If you're talking about just mild to moderate, that is, like adjustment problems. You can function at work. But when you're alone by yourself, that's when you lose down. So those are adjustment problems.
So does then such situation actually require medication?
Yes and no, because for me, if somebody, this is my personal, if somebody can't sleep, yeah, I would definitely want to find out what's the cause of it, why, and how long he or she is having sleep problems, because sleep and appetite are the first symptoms to, to be affected. All right, and I in my practice do not prescribe sleep medication, just monotherapy, because sleep medications lot of side effects. They are addictive, they cause dependence, they cause hangovers. So if you just give you a sleep medication, I have to be very cautious about myself, right? And sometimes we tend to overdose ourselves. Doctors will take half, we'll take one. So if you're having just pure sleep problem, then I will be very, very careful. But if you come to me with a sleep problem, but I will then again ask you about all the other symptoms of depression. And if I'm very, very convinced that yes, you have mild to moderate depression, I will then ask you, do you want to go on medication? Do you want to just be counseled about your issues? All right. Having said that, there are also herbal supplements that are quite placebo effect or what. They're quite effective in helping sleep and symptoms, some of the other symptoms of depression.
Emotional upheavals as well.
Yes, yeah. But usually these emotional upheavals, counseling helps a lot, provided you are, you talk about it, you're able to share, not suppress your feelings, but bring them out and talk about it.
Is it self-regulatory in something? Like, can it be done on by myself? Like, if I talk to somebody,
if he or she is a counselor, yes, why not?
if not,
then at least the person who's listening to you, he's a good listener. At least, probably is able to give you some suggestions.
so it's not necessary that I would require medication.
As I mentioned, yeah, if you can't sleep, then it's a big thing for me. Usually, in such situations, I would suggest just counseling or herbal supplements. To me, what I'm more concerned is when the person just can't move himself. Yeah? He's stuck where he is. He can't work. He cannot function as a husband or a brother or the person is supposed to function as at work, yeah, at home.
I did for about 2-3 months actually.
Yeah.
Became a hermit.
Okay.
It was more like withdrawing myself from everyone.
Sure.
But I just suddenly came out and started talking to Joanne and a few other friends, and that's why I'm quite interested to know, is it necessary? Because my GP actually told me that I have to go to the psychiatrist because of my kidney problems. So she said that it's better that I talk to somebody.
Usually when somebody suffers from a kidney problem, I personally would ask the patient to see the appropriate doctors first.
Yes.
Get that sorted out.
Yes.
Because I do not know whether it's the physical problem you're depressed, or because is it that you already were depressed before the physical illness set in. So that, to me, that's very, very important. That's a priority. Alright, because sometimes the medications that we give might interact and make the condition worse. So my priority is seek help first, get the appropriate help, and you can then come back and talk about your depression. Alright? For me, personally, if you have like for example, liver cirrhosis, and then you are depressed, you need to treat both together. Okay? You don't have to be afraid of, whether it worsen my condition, whether the medications will not be working for me. No, if you work as a team, yeah, you can always adjust the medication. There's no problem. Because my medications, I work very closely with my patients, and I write it down very nicely, how to take, when to take, what to do. And if you come back for follow-up, then I actually, taper off the medication as when you need it. If they are not lifelong medications, they are just short-term medications, up the chemicals, and then, you know, you look at other areas. Having said that, exercise is very, very important, yeah, because certain medications you put on weight. Yeah, your diet is also, you have to look at it very well. Spiritually also you have to be inclined. And you know, you should know when to get help. Okay, it works together. But you cannot separate. You know, if you don't treat one, physically you might be, everything seems to be good, but you're still down. So it's like, you're not getting well. Physically, then you're not improving. Among the patients here, have you felt any of the symptoms that I mentioned?
So, listening intently to what this is where I fall actually. Not as severe as what's mentioned. Okay, mine is the real case. I'm a patient.
Sure.
So, the discovery what you got that got this liver cirrhosis and something from that. Without even knowing what vertical liver cirrhosis is. And then you're told that it's a kind of problem. Then it takes some time to accept that situation. Okay. When something is discovered and there's an accident, it takes a period for it to accept the situation and the condition. So okay, you accept that. Then within a short span of time, you find other things happening. They seem to be very unrelated. I was diagnosed for osteoarthritis of both the knees and you feel that you were very happy when they overwalked and all of a sudden it wasn't they resist walking. And then suddenly whenever you find that walking is condition like all of pain, and then you see a doctor and they say your ligament is not looking out. Cartilage is one of them. They give something. Not very much of a cartilage. Fine. Okay. Let's begin physical. Okay, we do that. Because you're growing old, so maybe plan diet factors. Also try to reason out, zero then plan. And then suddenly what you call one day you wake up from your sleep in the middle of the night and you find your heart is pounding. And you don't know why it is wrong. You ask yourself whether you have been woken up from a nightmare. Sometimes that can happen with them. I'm getting my knees. But it's so unusual that I have aged even my knees. My partner is highly okay. So that was the problem. The device that I got one on policy. And you mentioned that it shows something like 180 kilo. Take it a bit concerned and of course there are many photos and all. But there is this concern why what they call things are happening within a short span of time, one after the other. Spiritual things are partly. Because that one what they call whether you believe or you don't believe, there are people who don't believe in it at all. So spiritual part of it apart. Purely physical, why is this happening like that? Also accepting that what you call you're growing old, I'm 65. So you're growing old, so all things are bound to happen. But there is still concern. Then you, at the same time you observe what you call yourself. You say, I find that there's a lot of irritability. Then, the other thing is physical. This surface is itch that you get. Then Dr. Ganesh has told me that in some advances, there's a term that we use when you get when it comes
Pruritus.
No. ascites.
Cholestasis.
Ascites.
Ascites is water in your tongue.
Let's go that. Okay, something to eat and all. Very directly related to liver cirrhosis. So you're wondering, yeah, I'm what you call controlling this, controlling that, and all these things, you know, not taking this and all, coming mixing regularly. Can that each be related to what you call liver cirrhosis? Or I'm also diabetic, so, or is it because of a diabetic? All this kind of thing goes on. So you're disturbed by that. How does what you call the disturbance manifest? Okay. From my what we call the way that I look at it, I observe myself between then and now. I could be feeling that stuff. I could be more irritable, you know. Can easily get irritated. Okay, that kind of thing. And then bit impatient. Not that I was very patient before, but it's worse now. So these two things. But I'm also aware of the development condition, right? So what I want to note of is when physically things are happening like that, not to be concerned about it, I think it would be very unnatural because it is happening. And then because it is physical, and then it is, you know, it causes pain or it causes, you know, some kind of a thing. So it would result in one being a bit unhappy about things like that. Until you reach a certain state, you feel very relaxed, you know, and if you look, I have accept this condition. That state of body, or you also concerned this heartbeat, supraventricular tachycardia, or some nickname they use, you know. So you also learn of this. So